we will talk about blood transfusion. So blood transfusion, it is a life-saving measure of transfusing blood or blood products from healthy donors to the recipients. So what is the aim of blood transfusion? It is to replenish the lost blood components in the person. Okay, so previously whole blood was given for transfusion, but nowadays several blood transfusion products are available to be transfused. So first of all, we'll talk about the indications of blood transfusion. Why the blood transfusion is needed? Due to accidents or blood surgeries that can result in blood loss, to replenish that blood loss. In case of exchange transfusion in hemolytic disease of newborn. In case of bleeding and clotting disorders like purpura, hemophilia, von Willebrand disease. Okay. In case of emergency surgeries, blood transfusion is required, and autologous blood transfusion. Okay, what is autologous? Auto means self. So in this, it is a form of auto transfusion. In the person's own blood that has been drawn earlier, it is stored and is retransfused. Now about blood transfusion product. So earlier I had already said that earlier whole blood was given, but nowadays blood transfusion products are given to the patients, like only RBCs, only platelets, only white blood cells, coagulation factors, plasma expanders, fresh frozen plasma. They can be given in several conditions wherever these are required. We can see the blood products over here. Now, what is the criteria for the selection of blood donors? Age should be between 18 to 60 years, and the donor shall be healthy, not suffering from any transmittable diseases. Level of hemoglobin must be equal to or more than 12.5 gram percentage, and the duration between two donations should be more than equal to 3 months in males and 4 months in case of female. Okay. Donor shall be having regular pulse and body temperature. Now there are two terms, universal donor and universal recipient. O blood group, basically O negative, is universal donor. AB positive is universal recipient. Now about the complications if there is mismatched blood transfusion. Earliest symptom is feeling of tightness in the chest and a feeling of suffocation, and the most common cause of mismatched blood transfusion, it is the clerical mistake. Person can experience pain in the chest, pain in the back, that can be caused by the clumps of agglutinated RBCs that can block the capillary circulation. Person can suffer from immediate hemolytic transfusion reactions like febrile reactions, allergic reactions, transfusion related acute lung injury, or transfusion associated circulatory overload. It can also occur, air embolism, or some delayed transfusion reactions like iron overload, renal tubular blockage, renal failure, disease transmission, hemoglobin urea, renal failure, and death can also occur in severe cases. Now, hypotension, renal vasoconstriction, and renal tubular damage. These three factors, they can cause death of the person by the sequence of reactions or changes that are shown over here. Okay, accumulation of urea inside the blood, coma, ultimately death can occur. So basically, if the urine is acidic and the GFR is low, then hemoglobin that passes through the glomeruli and renal tubules, it gets precipitated as acid hematine that mainly obstructs the lumen of renal tubules, resulting in renal tubular damage. Thank you very much.